It's the Slam Dunk.
Okay, so Health Minister Shane Reti is fast becoming, in my view, a serious liability for Christopher Luxon. The list of problems and crises on his watch continues to mount, and he's been utterly ineffective in hosing them down, and even more useless when it comes to resolving them, to be honest. The list is long. The latest debacle involves, of course, the ambulances and the drivers going on strike. Nothing screams frontline services getting cut like ambulance drivers. Take them away, and you're driving yourself to hospital. Or worse, you're dying alone. It's money they want, but National has been hell-bent right across the board of these cuts to public services. It promised it wouldn't affect the front line. This impending strike makes a mockery of National's, frankly, meaningless pledge. And it exposes the public to very real risks, and we heard that this morning, didn't we? Remember, National pledged to fix up the ambulance services when it was in opposition. Strangely, they're now suffering sort of clinical amnesia and can't recall any such promise, can they? And for Reti, it leaves him looking utterly stranded and about as effective as a sacked broadcasting minister Melissa Lee, who looked clueless in the face of the media collapsing, didn't she? So I'd argue that Reti is now drawing attention for all the wrong reasons. Sure, health is an awfully tough and complex job. And remember, Jacinda Ardern sacked David Clark when he was health minister during COVID. He just wasn't up to it. The bloke went to the beach, remember, for the walkabout during the lockdown? Yeah. But here's Reti in his list of shame since taking the job. The big one, of course, they forgot to include funding in the budget for the 13 new cancer drugs. Once we reminded them that they were wrong, they came up with 14 different excuses. And in the end, they found the money and they bought the drugs. But the damage was done, you see, and it was crucial. Reti has failed to fix up festering sores. Nurses were trained here, but they haven't been hired due to a hiring freeze, and they're cutting costs. Health New Zealand's tried denying it. Stop digging in. The Waikato nurses were offered jobs, but in the end the job offers were recalled. Just joking, maybe next time, they said. Ultimately, the buck stops with Reti. Where is he? And what on earth has he been doing? It's headline after headline as each day goes by, and an utter mess, and no one appears to be winning. Reti, to me, is on borrowed time. The clock is ticking, and I can't see how he turns it around from here. GPs are screaming out for funding and no longer take on new patients. That's crucial. What's Reti doing about that? Nothing. Primary healthcare is a shambles. GPs' fees are going too high, and we're hugely short of doctors, and people are turning up to hospitals to get sorted, which means ED wait times are depressingly long. What's Reti doing about that? Nothing. Prescription fees have returned, and the government is making smoking cool again by bringing it back, ditching the smoke-free laws. What's Reti doing about that? He's voting for it, supporting it. Vaping's gone next level. National's promised to kick the tyres on vaping, has only seen it kick the tyres down the road. Utterly useless and asleep. What is Reti doing? He's kicking the tyres down the road. Tough former health ministers like Annette King and Tony Ryle all would basically threaten both sides of any health dispute that if they took their issue to the media or out into the public and embarrassed the government, then there'd be no result. So stand by for fire and fury, they'd say, and your issue would never get resolved. The best ministers, they lock it all down before it makes the front pages, or worse, before it becomes the subject of a slam dunk with the editor-in-chief, you see. It worked, and it worked really well. I personally believe that Reti has no idea how to solve these big issues. And that will soon cost Luxon points in the polls if it hasn't already. Reti must go. And Luxon's, I could already know this as well, I reckon. Right.